Hey all, it's Alex again, and I am now 11 days post-op from surgery with Dr. McEvanu out of the McLean Clinic in Mississauga, Ontario. The first few days after surgery, I literally just slept. We came home after my post-op appointment the day after surgery, slept for the entire 2.5 hour ride home, and then basically just stayed in bed for the next 3 days. For the first 3 days post-op, I was on 2 oxycodones every 4 hours. My husband Logan helped me make this chart, which was really invaluable. It would have been really easy to lose track of how much medication I was taking. So, can you see this?
Mm-hmm.
Okay, so this literally just shows the date, time, and how much medication I took. And we followed that through, and I'm still doing it now. After the first 3 days, I went down to 1 oxycodone every 4 hours, and by the end of that day, I stopped taking it altogether and switched to extra strength Advil.
Actually, the first 2 days, the first day you were on 2, and then as of 3:30 the second day, you dropped down to 1.
Okay.
And then at the end of the midnight of the 29th is, so like, the turn between the 29th and the 30th.
Whatever. Anyway, so the extra strength Advil now is more than enough to control my pain levels, so that's great. I started getting restless, I think, about 4 or 5 days post-op. Started gradually being more active at that point. Now I feel like I can do most of the things that I would regularly do, except, of course, lifting my arms up. This is pretty much as high as I dare go right now.
And you also can't lift anything heavy, of course.
Exactly. So yesterday, I had my 10 days post-op appointment at the McLean Clinic, and as you can see, they took off the nipple sponges and all the dressings, which was very painful, because as you can see, I'm a pretty hairy guy, but also because they had to take off the tape from the incisions that ripped off some scabs and stuff. It was not fun, but it's over pretty quick. And then they let you go and you can go and relax. I recommend taking painkillers about an hour beforehand. I did that, and I think it helped a lot. So this is my chest. I'm so happy with the results so far. Dr. McEvanu is amazing. He's been at the McLean Clinic for about 8 months. He's been working with Dr. McLean there for years before that, and now he is the McLean Clinic top surgery specialist for FTMs. He does about 3 surgeries a day, just these FTM top surgeries, and that's working through McLean's ridiculous wait list. So hopefully people will get through sooner now. But yeah, he's amazing, and I couldn't be happier with the results. I'm still getting some swelling. I have to keep the post-operative binder on for another few weeks. They recommend, because they did so much liposuction, because I had large breasts before, they recommend up to 6 weeks with it on. But after the first 3 or 4 weeks, as of right now, they suggest not taking it off for more than an hour or 2 at a time. And especially not if I'm going to be active. So yeah, so my nipples are looking good. Everything they said is pretty much the way it should look now, and I'll be having another appointment in 2 weeks to follow up, and I'll let you know what happens. Thanks. Have a good one.